Because Thai people are suffering from such waterborne diseases as typhoid and hepatitis A, our target population's current needs are education on these diseases, clean water, and treatment for those who are infected. Aid workers from the Water Project at waterproject.com say, like other Asian countries, increasing population, urbanization, agricultural and industrial expansion is impacting the water quality of various water sources. Pollutants from human activities also contribute to the degradation of the water quality. The severe flooding in the rainy season and extreme drought in the dry season could become two major sources of Thailand's water crisis. They also tell us that 1/3 of the surface water in Thailand is polluted. Another issue is that agriculture is taking up approximately 70% of the country's total water supply. It has been estimated that by 2025, Thailand will be facing a severe water scarcity issue. According to Katerina de Albuquerque, a human rights reporter for the UN, rivers and other sources of water are being increasingly polluted by the discharge of untreated human waste. I was shocked by the very poor management, disposal, and treatment of human waste, which may be one of the major causes of the increasing diarrhea morbidity rate in Thailand, in spite of the high basic sanitation coverage that has been achieved. The CDC website tells us that the two most prevalent diseases in Thailand that needed to be avoided are typhoid and hepatitis A, both of which stem from contaminated water and food. For those who can afford it, there is plenty of bottled water available for drinking in Thailand, but the problem with that is that bottled water is not an affordable option for many of the people, particularly the ones that live out in the villages, and that no one can afford to cook with bottled water. Because of this, even people who aren't drinking contaminated water are eating food that has been cleaned with or prepared with the contaminated water. Another big issue is personal hygiene. It's rare for Thai people to wash their hands, especially after using the bathroom, again, leading to contamination. This is where the needs of this population come into play. If we can teach these people, particularly in the remote villages, that contaminated food and water are the causes of the illnesses and diseases, and teach them how to reduce contamination, we can at least partially help to alleviate the sicknesses from these diseases. But personal hygiene is only part of the problem. The bigger problem is that clean water is rare and difficult to come by. This is why we need to find places with plenty of groundwater and build sanitary wells to help alleviate the lack of clean water for drinking and cooking. Finally, there needs to be help readily available to those suffering from typhoid and hepatitis A. Healthcare in Thailand is not always readily available to people living in the more remote areas of the country, and even when it is, people who struggle to find a way to feed their families and to feed themselves every day can't pay the costs involved in treatment or vaccinations for these diseases. If we can provide the vaccinations and the voluntary medical personnel to administer the treatments and vaccines, we can greatly reduce the burden of disease in Thailand.